Here's the drill. You ask your nutrition questions. I'll do my best in the next hour to get those answered for you. Keep in mind, the show is not about medical advice. I'm not trying to replace the information that you have with your doctor, but it's for educational purposes. So, you know, cue that up. Also, if you're new to the show, make sure you understand that we're all about sharing. So if you find this information helpful, we want you to pass along to your, to your friends, family members, etc. You can copy and paste that URL and just hit share. So without further ado, let's jump into your questions. BJ's asking, is there a way, or are there ways I can regenerate or rebuild elastin in my skin, mostly my face? Probably one of the best ways would be to use infrared lighting. I'm a fan of, there's a machine called a platinum LED. They're a little more expensive, but they're relatively affordable. And they're an FDA approved device for infrared. You can buy them without a doctor's prescription. You can buy them for home use, but infrared is probably one of the best ways to stimulate collagen and elastin in your skin, especially around your face. Other than that, I would look at nutrition. A lot of times what we see in people who have accelerated aging patterns, right? More wrinkles, more less elasticity rather in their skin, are people that suffer from protein malnourishment. So they don't get adequate protein in the course of their day. From a protein perspective, we want to really see about a third of your total calories. So if you eat 1,500 calories a day, and just broad general numbers, 500 of those calories should be protein. Roughly, that means about 125 grams of protein per day. There's 4 calories per gram of protein. And so, again, 125 grams. When we have our patients in our clinic, when we have them do like macro counting just to see where they're at and get a baseline, the average person that we see is half. They're somewhere in the 60 to 70 grams per day. And it's not enough. It's not such a severe protein malnourishment that that you're going to end up immunocompromised in the hospital, but it's low enough to reduce the capacity for your body to make elastin and collagen and grow hair regularly and grow your nails regularly, recover from exercise regularly. So protein becomes very, very important. Vitamin C also becomes important in this equation. Vitamin C and copper specifically. I always test people for deficiencies, and if you're really looking for a nutritional answer around your specific elastin disruption, get tested. We do what's called INA testing, intracellular nutritional analysis testing, to identify what nutrients you need. And so, but vitamin C and copper have a specialized role as it relates to the collagen in your skin and under your skin, and that is they form what are called collagen crosslinks. Your collagen is what we call a tripeptide. It's a triple helix protein, and in between the strands, you have these cross linkages that are what create the elasticity and the resiliency of your collagen. And these are stimulated properly by copper and vitamin C. So if you don't have adequate amounts of either one of those nutrients, you can very much end up with collagen that breaks really, really easy. It can cause your skin to sag more readily. It can make you look older. Obviously, other things like alcohol, smoking, aggressive exposure to chemicals or fast food or ultra processed food. These are all things that are going to deplete your body of key nutrients that play that role. So those are the things where I would start. Ultimately, I'm a big fan of testing and not guessing. If you're not familiar with the INA test, we'll put a link up in the feed below and you can read more about it. Still have a lingering dry cough after getting a cold on Christmas. Any suggestions for getting rid of it? Yeah. One thing you might consider is a zinc lozenge directly with some marshmallow, so that can soothe the throat. A lot of times it's the inflammatory damage from the infection itself that has damaged the lining of the throat. and that can linger. We have a product at Gluten-Free Society called Zinc Soothe, which is a lozenge. And I would recommend you take a couple of those a day and see if that doesn't help you. Aside from that, you can also do some other things. Gargling with salt water, gargling with a hydrosolized silver compound can be soothing. But that's where I would start. You also just kind of have to give it time to recover. But I would start there first. And then come back next week and let us know if that helped you. Is there a significant increased risk of cytokine storm when taking elderberry? No. No, I don't know why this question comes up so frequently, but elderberry is not going to, we talk about supplements that, quote unquote, boost the immune system, and elderberry comes into the context of that conversation. But elderberry is not making your immune system stronger. It's not making your immune system want to be more aggressive. Elderberry, it's supporting your immune system's regulation. So it's not making your immune system overreact. So there's no contraindication for using elderberry if you're trying to overcome a cold or a flu. It's actually something I recommend highly. We have a product called Virid, and it contains elderberry, among other things, zinc and vitamin A and andrographis. But we recommend, if you're actively fighting something, take 4 a day to support that immune system. Again, the elderberry's in it, and there's no need to be worried about taking it. Let's see here. So I'll back up just a little bit. There we go. Just starting to have symptoms of a cold, how to beat it fast. Okay, the quickest way, I got banned a few years ago for saying this. And I got wrote up in New York Post, and Business Insider wrote a hit piece on me for saying this, but I'm going to say it anyway. I'm going to say it again. The quickest way is vitamin D. But you got to take it the right way. 150,000 international units a day times 3 days. You want to get rid of it fast? That's how. When we talked about this a number of years ago during the epidemic or the pandemic or whatever you want to call it, initially that video we did got scrubbed. They deleted it. They gave us no opportunity at explaining why. But ultimately, that video landed a Fox News reporter to reach out to me, and we did a whole story on it, interestingly enough. Actually, I think that's in our YouTube channel, that story. That story broke and went international. And after that story, I had, there's a town in Ohio. I had a mayor from that town call me. And he said, I saw your story on Fox. I don't want to use this money that the government's provided to buy a bunch of masks. What I'd really like to do instead is get all the citizens vitamin D so that they can do this therapy right here. And that's exactly what we did. I connected the mayor to my supplier of vitamin D, and we got everybody in that town, thousands of people, high-dose vitamin D. Anyway, that just an interesting story, but that's the best way. If you're really looking to get it done quickly, that's first. I would do that first. And then from there, you can do other things. You can do vitamin C. You can do higher doses of zinc and quercetin. You can do high doses of N-acetylcysteine, for a time, but vitamin D is going to be your gold standard to try to knock it out right now. Let's see, back it up again for me, Mel. Sorry. There was a question about epidermal cysts that I wanted to answer. Here we go. Do you have any supplements or recommendations for epidermal cysts in a 24-year-old male? Laura is asking. Yep, I do. The biggest problem with this type of cyst, there's two. And the first is iodine. Now, depending on this 24-year-old, depending on what his diet looks like, fish and kelp are your two predominant sources of iodine in the diet. I don't know a lot of 24-year-olds that are doing this aggressively. So if he's not, he's probably not getting adequate iodine to cover himself. And iodine deficiency can contribute to cyst formation. So I would look at iodine supplementation, and probably in this type of situation, I'd start out around 12.5 milligrams a day, and I might go for 6 months. Ultimately, I would test first, but I would, without a test is really pretty safe dose for them to take. We have a product called Ultra Iodine at Gluten-Free Society if you are wanting to do that. The other thing would be, so number 2 would be blood sugar control. I have seen this, it's in teenagers, I've seen it in young adults, even the ones that aren't overweight or obviously obese, but their blood sugar's out of control. It creates an increased risk of cyst formation, not just epidermal cysts, but also ovarian cysts, among others, and it's blood sugar, which is disruptive and can lead to cyst formation. So monitoring this, making sure that the diet is so dialed in that blood sugar problems aren't the issue. Now, I said earlier about protein, getting a third of protein. So 1,500 calorie diet would also be 500 grams or less of carbs. And I know a lot of times, I'm sorry, not 500 grams, 500 calories. Sorry, that was way off. Which would be about 125 grams of carbs or less in that example of a 1,500 calorie diet. But what we'll see a lot of times is the carbohydrate content of people with cysts are 70, 80, sometimes even 90% of their total calories. And that's going to drive those formations to occur. So control the iodine, control the blood sugar, and then let us know how that works. Come back and let us know if it was helpful. Is there a significant increase? Okay, answered that one. No matter what dosage of magnesium bisglycinate I use, I get loose stools. What's wrong with me? Nothing. You just don't do well with magnesium bisglycinate. You might just instead try just a straight magnesium glycinate or a magnesium citrate or a magnesium taurate. Would be options, and see if you can tolerate magnesium that way. Remember that magnesium is a osmotic, and if you're saturated with enough, you don't necessarily, a lot of people want to take it because there's a lot of information online about magnesium deficiency, and because magnesium is just such a vital nutrient and it has hundreds of different functions in the human body, it can cause virtually any symptom when you're deficient in magnesium. So a lot of people want to take it because they're like, oh, I have those symptoms, maybe I'll benefit from magnesium. But if you're really, truly not magnesium deficient, it can cause loose bowels. So it may not be anything wrong with you. It may just be that it's wrong for you because you don't need it. This goes back to the testing, right? Do a test, INA. But if you're not testing, at the very least, check out some other options like taurate, like magnesium citrate, and see if those do better for you. Dr. Osborne, could you do an educational series or episode on the history of the Rockefellers, Kellogg's, Pharma's, conflicts of interest? I think do we have something like that, Mel? Didn't we do?
There's a series.
Yeah. Jessica, check out our show. What do we call it? Serial Killers?
So.
Yeah. We'll find it and put a link up for you. But a lot of that's in there. Not all of it, but a lot of that is in there, and you'll find that interesting. What would cause one's blood pressure to fluctuate from normal to high levels, even being on prescription meds for high blood pressure? So lots of things. I mean, you could stand up and walk across the room and your blood pressure can fluctuate. It can go up 10 or 15 points, depending on, how in shape or out of shape you are. I mean, I guess it's hard to answer that, Mary, because there's just not enough context. I mean, you could have a zinc deficiency, a magnesium deficiency. You could have a problem with mold in your house leading to blood pressure fluctuations caused by an autoimmune process called dysautonomia. Like, it's all over the map, all the potential possibilities of why blood pressure might fluctuate. I would say I'm gonna put some context to your question, and if it's wrong, I apologize. But let's just say that your blood pressure at rest, because the way you're supposed to take blood pressure is sitting down at rest. And if you're not taking it that way, you can get wild fluctuations from one reading to the next. So maybe we could post our how to take blood pressure properly video up too for Mary. Mary, watch this video And if you're taking your blood pressure properly and you're getting those deviations, now we have to start thinking about micronutrients, vitamins, minerals, what you're eating, and environmental exposures to potential toxins. Those are going to be some of the biggest things that are going to drive it. And I have a whole show on that where I do a deep dive on blood pressure and a bunch of things that you can do both naturally and through diet and lifestyle behavioral change to really get it under control. And so watch both of those, and I think you'll find some solid answers in those. It's harder for me to answer your question specifically without more context, though. Is sorghum gluten-free? Okay, no, it's not. Let me define that. If you haven't watched the Glutenology Masterclass, it's 14 hours long. Any of you who are new to the channel, to me, you should do two things first. Number one, get a copy of No Grain, No Pain. It's my book. It's an easy read. I wrote it, so that it wasn't super complex, that people could grasp the message. And then number two, watch the Glutenology Masterclass. Because I can tell you haven't done either one, because I talk about sorghum in both. And it's not picking on you. I'm just trying to give you resources. But sorghum, if we look at traditionally, if we define gluten is defined as the seeds of protein that are contained, the alcohol-soluble protein contained in the seeds of grass. That's the fancy definition. Traditionally, in the United States and Europe, we limit that definition to what's known as BROW. I'm giving you an acronym here. BROW. What does that stand for? Barley, rye, oats, and wheat. So what we call the brow grains are going to be the kind of ones that traditionally we would say contain gluten. But that's only partially true, because grains like sorghum and millet and corn and rice also contain gluten. They just contain a different kind of gluten, but they do contain a gluten. And some researchers are looking at this. I've been looking at this for 25 years. For example, we know that corn gluten causes, actually, in some studies, more damage than wheat gluten does to people with celiac disease. We know that rice can cause something called FPIES, food protein-induced enterocolitis. And we also know that sorghum contains a type of gluten that, again, different from the type found in these classic grains, that in some studies show inflammatory damage to people with gluten sensitivity. And we know millet contains a type of gluten. Panacetin is the type of gluten found in millet. So although these grains, by law in the US and UK and other places, you can have products that contain these, and by law, they can label them gluten-free. And this is one of the core fundamental problems when people are trying to go on a gluten-free diet initially. Many of them are celiacs, not all. Some are what we call non-celiac gluten-sensitive individuals, but the celiacs are told, you just really have to avoid this. And a lot of times with celiac, they'll even say oats are okay, because they're now trying to blame cross-contamination of wheat into the oat crop as why people react to oats. But oats actually do contain a type of gluten called avenin, which has been shown to cause inflammatory damage to the GI tracts of celiacs. But one of the fundamental problems here is that you're not going to learn this. Your GI doctor is not going to teach you this. Generally, when you get a diagnosis, what do they tell you? Go read about going gluten-free online, and that's the end of it. They're not going to sit down and talk to you about the nuanced details of the diet. That's why I wrote No Grain, No Pain, because people are literally dying over going gluten-free in an improper way. We know from research, there's 5-year studies, there's 2-year studies that show that up to 92%, this is a huge number, 92% of people going on a gluten-free diet where they're following the restriction of barley, rye, and wheat don't heal, don't have villus atrophy reversion, meaning they maintain what's called refractory disease, where they're still struggling. And this is a big reason why. It's not the only reason why, but because they're going to the gluten-free food aisle and they're buying corn products and rice products and sorghum and millet breads, and they're still struggling, and they don't know why, because they think they're gluten-free. So it's one of those situations where you don't know what you don't know. Most of the doctors aren't trained in this. They get 5 minutes on celiac disease in med school for the most part. And the research just is largely ignored. Again, why I wrote No Grain, No Pain. So when you're asking, is sorghum gluten-free? The answer is no. Technically, sorghum is not gluten-free. Can you classify sorghum as gluten-free based on the current laws of food labeling in the US and the UK? The answer is yes, and that's where the confusion comes in. So hopefully that gives you at least a little mini crash course in it, but go check out those 2 resources and you'll get the deeper dive and you'll have a better understanding. We see it all the time in my clinic where people have been on a gluten-free diet. What a lot of people don't get, let's make some room here. A lot of people don't get is that gluten is the most common cause of autoimmune disease ever studied. It's been linked to more forms of autoimmune disease than any other one thing we could point at. And that being the case, there are a lot of people, they have celiac. And I just saw a video of a woman talking about this, but they also have, maybe they have like Crohn's. So they got both. They got both conditions. Or maybe they also have rheumatoid arthritis or Hashimoto's. And here's what their doctors tell them, right? Their doctors don't tell them that gluten can actually cause all of these autoimmune conditions. Their doctors just simply link gluten to celiac. And so here they think, okay, I got to go gluten-free for my celiac, but if I have this one, and this one, they make the doctors don't make any mention of the gluten association between these other types of autoimmune diseases. And so what happens is when they go gluten-free in a traditional way where they avoid barley, rye, and wheat, some of their symptoms improve. Like if they have severe diarrhea or severe gastric problems, a lot of that can get some better. Like they might have improvement. In some cases, they still struggle with other health problems that they don't associate with the gluten consumption. And these are examples. So like, yeah, my celiac got better, but I still have Crohn's flares. Or my celiac got better, but I still have joint pain from RA. Or I still have low thyroid and I have to continue to take medicine. It's because they keep eating the rice, they keep eating the corn, they keep eating the oats and the other grains. And so those types of glutens are also driving these types of autoimmune conditions. I see it all the time. And we get so many people in my practice where we really start changing their diet in the proper way, taking them gluten-free in the proper way. And guess what? Gets better, gets better, gets better. So don't forget that, especially if you're still struggling. And just, I know it may be overwhelming because a lot of people going gluten-free are just looking for alternatives to bread and cereal and pasta. But the best advice I could give you is quit looking for alternatives. Eat meat, vegetables, and fruit to start, and let your body heal. Give your body time away from that stuff, because a lot of that gluten-free food, despite the fact that it's not really gluten-free, is also ultra-processed junk food. It's not doing you any favors. And when your body's trying to heal from years of damage, eating junk food is not going to be your friend. Should I be doing something if accidentally gluten from a restaurant that causes DH rash? Karen's asking. Yeah, supplemental help. Yeah, there's a lot of supplemental help here. We did a whole show on what to do when you get gluten. Mel, can we post that? I'll post that link for you on the feed below. But since you asked the question, a couple different things. Number one, I recommend anytime you eat other people's food, whether it's a restaurant or family, that you preemptively take this Gluten Shield. So what it was designed for, I designed this product to basically, not for you to go eat pizza and have a bowl of pasta. It's designed for accidental exposures, cross-contamination exposures. So you take it before the meal as a buffering agent. I have another product you can take too if you're really not sure what you're getting into, but it's called Mycobinder Plus, and it's got zeolite and charcoal and fulvic acid in it. And what that will do is it can actually help bind some of that gluten that you might get exposure to, and helps you poop it out. The other thing you can do right after that meal, if you're starting to feel bad because you realize you got gluten, you can do something called a detox C flush. And that'll just clean out your bowels. That'll just reset, clean out your bowels, any gluten that was lingering in there that hasn't fully gotten into your bloodstream to create antigen antibody complexes, which is what causes the inflammatory damage. You can poop that stuff out and hopefully not get sick from it. When taking antibiotics for an emergency, is it best to take with or without food? I'm also taking probiotics 1 hour before bed without food. So when taking antibiotics for an emergency, is it best to take with or without food? It's best to take it as the bottle is prescribed because there are different kinds of antibiotics. So always, default back to what the manufacturer is saying about their antibiotic product. If you're talking about probiotics and antibiotics and you're trying to take probiotics too, you want to give ideally a 2-hour gap. So if you took your antibiotic in the morning and you're trying to offset that with a probiotic, wait 2 hours and then take your probiotic. Or vice versa. Take your probiotic first, wait 2 hours, then take your antibiotic. And you should space that. If you're trying to use probiotic to space with antibiotics, you should take the probiotic twice in the day. You should take a morning dose and a nighttime dose, especially a nighttime dose on an empty stomach, 2 hours away from the antibiotic, so that you give your microflora time as you're sleeping to establish. I like this. So somebody says, INA testing is very helpful. I feel much better after taking the supplements for 6 months. So yeah, if you do INA testing through Gluten-Free Society, and then you can tailor your supplement nutritional needs. I mean, it's funny, I've had people come to my practice. One guy, he had, was it 2 or 3? I don't remember if it was 2 or 3. It's been a long time. It's probably 15 years ago. Well, he had a couple of suitcases. And he had a little organizational system. These weren't little suitcases. These were like the kind you travel when you're going on like a 3-week vacation type suitcases, right? So the big ones. And he puts them up on the exam bench in my office, and he flips these suitcases open, and he's got it's really, really organized. And he's like, okay, on Mondays I take this one. On Tuesdays I take 2 of this one. And he's got like 100+ bottles of stuff that he's taken overall in these 2 suitcases. And I'm like, why are you doing all that? And he's just like, well, I just keep reading about how this nutrient is helpful and that nutrient's helpful. I said, you need to get a test done. We're going to test you. And that's what we did. We did an INA test on him, and we got rid of his suitcases, and we got him to a manageable amount of supplementation that was tailored to his need. But I mean, he was spending probably thousands of dollars a month on supplement pills with no justification for the fact that he did or didn't need any of them. And he didn't feel necessarily any better doing it all. He was just trying to be preventative. So if that's you in your mind, if you're watching an infomercial at midnight and there's a new product, and then you watch a video the next day and you're learning about a new nutrient, whether it's for me or any other, doc, consider testing as a means to dial it in. I swear, it's so beneficial. I get dry skin around the lips and palms, especially from intense exercise and B2 deficiency. Are you asking me if that's a B2 deficiency? Because dry skin around the lips can definitely be a vitamin B2 deficiency. It can also be an iron deficiency. If you're female, and I don't know by your name, but if you are a female and you notice it specifically, the week of and after your cycle, I would consider iron, because with that blood loss every month, iron deficiency causes chapping of the lips, dryness of the lips as well. What would cause one's blood? Okay, I think I answered that one. What to do for a fever? Get rid of it or let it pass? I'm a fan of letting it pass, unless there's 2 reasons to lower fever. One is if it gets too high. Now there's arguments and debates about what's too high. Over 105, you definitely probably feel awful and horrible and really should probably push to get it down. Most people can tolerate, 103 up to 103 relatively okay without having just severe body aches and pains, but it's different for different people. I've seen some people even at 103 or 101, they're like so achy and so painful, and they just can't think straight and they're dizzy. Lower that fever. But if you can push through it, let it ride. I know it's kind of generic. Go back on to watch Tuesday's show. I did a whole section on, fevers specifically, but if you need to lower it, I would look at white willow bark versus ibuprofen or naproxen or even Tylenol. I would look at cold compresses as a measure to try to lower them as well first. You remember the fever has a purpose. Your body is actually producing that fever in an attempt to try to help you. And so we want to try to let it ride. But I understand if it gets so hot that you need to get it down as well. I mean, it's a judgment call. How can I get rid of cherry angiomas? I got them after mold toxicity, but mold was remediated, but cherry angiomas did not go away. Get your hormone levels checked. And get your, if you've done proper detox, one of the things that continues to drive cherry angiomas is a mycotoxin called Zea. And it's made by a mold called Fusarium. And what happens is it mimics estrogen. And if you still, after getting out of mold or having remediation, if you still have an abundance of this inside of you, it's going to behave like estrogen. And of course, estrogen is going to increase cherry angioma formation. And so that would be what I would say. Start with that. The other thing you might consider, though, is what else are you being exposed to potentially that also might mimic estrogen? Phthalates, plastics, and other compounds that we're exposed to environmentally that aren't good for us, that are estrogen, what are called xenoestrogens, can also drive this. Not having adequate quantities of folate can contribute to this because you need folate to properly metabolize estrogen. And so a lot of times we'll see people with low folate levels having this similar kind of problem here. And it's not just folate, but folate's one of the main ones. Folate, zinc, B6, and B12 can all contribute in that regard. Let's see. I can't buy your supplements as I am in Europe. Would like to know which other instant of grains are you using to make bread? There's a lot of gluten-free. Let's post. We have an article on this. It's on grain-free flours. And so if you're looking to make, a bread substitute with truly gluten-free substitutes, we're going to put the link up for you, Mara, in the feed. How do you get rid of lipomas in the arms and thighs? It depends on what caused them to form. I mean, there's different reasons why a lipoma might form, but I would start with probably some fascial work and activity and exercise, and making sure that you don't have a carnitine deficiency, making sure you don't have a niacin deficiency, that's vitamin B3. Those nutrients play a major role in the metabolism, the proper metabolism and regulation of fat storage. Make sure your choline is normal. Make sure your inositol is normal. Also play a role in how fat is deposited and stored in tissues. I love this. Thanks for sharing, David. David says, I just received your book, No Grain, No Pain, in the mail. I have MTHFR and now down from 121 kilograms to 85 kilograms. Have been one of my lifesavers. Appreciate your time on this channel. You just made my day. Appreciate you, David. Do you think low heart rate is a symptom of MGUS? My husband suffers both. It could be, but I generally, when I see low heart rate, if the person's not an athlete, or doesn't have a history of being, like a marathon type person, I would more specifically, I would think of POTS, which is a form of dysautonomia, where heart rate is affected tremendously. It's lower typically. And this is in my experience, this particular condition, gluten can certainly be a driving factor in it. I don't know if your husband's gluten-free, but if he's not, definitely would look at that. Seen mold play a major role too in the driving of low blood pressure, as defined as POTS. So I would look at those two things, Marina. The protocol for frozen shoulder depends how frozen it is, because there are different types of exercises. But one thing you can do with that frozen shoulder is just do wall crawls. Real simple. You just take that arm up, and if this is a wall, imagine I'm miming for you here, but you just crawl your fingers up the wall as much as you can tolerate, and then walk it back down. So if you're really frozen, like with frozen shoulders, some people are like here and some people are like here. They have decent range of motion, but it's a little locked. So depending on how much you can move that arm, but you crawl it up the wall and down the wall. That's a real easy starting exercise. Internal and external rotation exercises. Get with a good chiropractor, that treats frozen shoulder, get with a good physical therapist that treats frozen shoulder. Either one could help you and design a custom protocol, because it's also not a one size fits all either. There's different reasons why frozen shoulder occurs, and somebody needs to diagnose you and give you, and look at your movement patterns and look at your behaviors. If you're not already following no grain, no pain, do so. I see a lot of people develop frozen shoulder from the inflammation of eating grain. So this is one of those things that we'll see cause the frozen shoulder in the first place. The problem with frozen shoulder is once you have it, you're guarding it. The motion, the movement, you're guarding that arm, that shoulder, and now you get atrophy. And so then it's a lot harder to rehab. So the key is get it evaluated, get your diet dialed in. If you're looking to take some things to help with the inflammation, you want to be on 2 grams of omega fatty acids. We have something called Ultra Omega, which works really, really well in this situation. You might also get some vitamin C, 5 grams a day, and quercetin, about 4 grams a day for a few weeks. Get that inflammation supported and get it under better control, right? Get your diet dialed in, and then get that shoulder evaluated, because there may be some specific activities and exercises that you need to do that's unique to the findings of a physical examination. What supplements, amino acids, vitamins, minerals for IBS-D mixed? Well, I'm going to give you the same advice, Vance. Not exactly, but no grain, no pain first, because if you have irritable bowel syndrome, the likelihood that it's coming from your diet is 100%. 100%. Now, beyond that, beyond changing your diet, we're talking about supplements and nutrients. Here's where we're gonna prioritize. Number 1 would be probiotic. Very, very common that those with IBS have disruption in their flora, and a good, strong probiotic is a great place to start. Now, my favorite for this is something called Ultra Biotic Defense. And it's a powder, and you mix it in water and drink it. And you drink 1 of those a day. But that's where I would start here. Now, I would also consider L-glutamine. I would consider zinc, particularly a special kind of zinc called zinc carnitine. We actually have a product called GI Soothe with both these ingredients and a few other ingredients in it that would be good to just kind of help calm the fire, so to speak. But this is where I would start. Beyond that, I mean, these are generic recommendations. You really probably should get a microbiome test done of your GI tract to rule out any kind of dysbiotic flora or yeast overgrowth or anything else that might also be in your gut contributing to this that's non-food or non-diet related. What can be done for narrow jaws, teeth, grinding, mouth, breathing in a 7-year-old? Now, I'll just say this. I'm not a dentist, but I have some experience here in that there's a type of procedure, or not so much a procedure, but it's an orthodontia. So you get you a good orthodontist or dentist who understands. There's a special bar called a Herpes bar. I hope I spell it right. And what it is, if we look at the jaw, so this is, again, I'm a terrible artist, so forgive me for that lack of ability to draw very well, but it's a bar that basically goes across and it has a spring load in it, and the dentist can set it, or the orthodontist can set it so that it pushes out. So as you're putting braces on a young child and you're trying to expand the jaw, bone grows based on pressure, but so bone will move or morph into the direction of pressure. So if we're putting pressure out like this, you can get better jaw expansion. So that may or may not be the solution for your daughter. I don't know, but I would find a dentist who understands that, who uses that type of technology, and see if it's right for your daughter. You know, the other thing you could have, if she's mouth breathing, you could have her evaluated for, for a lot of different things, but one of them would be diet, because what we see a lot of times, and especially in kids, sugar will cause a swelling in the nose, which will lead to mouth breathing, because they can't get enough air through the nose. The nose won't open. You get congestion and it won't open. And when you're not breathing through your nose, you get atrophy of the facial muscles and facial structures. And this is one of the reasons why we see narrower jaws. Is beyond the food. If you go read the work of Weston Price, he was a dentist who did research early on in the 1900s and found that cultures that didn't have processed food had these really amazing jaws, and they had almost no cavities. And then when those cultures introduced processed foods and sugars into the diet, what he found was their jaws started to narrow and their facial bones started to narrow. And one of the reasons why is when you ingest ultra-processed food, it affects how you breathe. And when you're not breathing through your nose, your face atrophies, your jawline atrophies. So this may be part of what's happening with your daughter. So going back to eat real food, follow a great diet. No grain, no pain is probably one of the best places to start as a non-inflammatory diet for her. And then from there, maybe consider some nutritional testing around vitamins and minerals, amino acids, to see what she might be lacking in, because there are some nutrients that play a role in proper development. Zinc would be a classic example, and copper would be another example of nutrients that, when not present during development, can lead to structural abnormalities and problems. Is intermittent fasting helpful or harmful in responding to acute viral illness? So there's an old wives' saying, and that is, starve a cold, feed a flu. And I find that to be pretty true. So it depends on what you're dealing with. But if you're talking about fasting, if you have a flu, eat. If you don't, if you have a cold, then fasting is not a bad thing. Is flax meal bad for my Hashimoto's thyroid condition? Not necessarily. Flax meal might be bad if what I would say, if you're going to use flax, what a lot of people do is they buy this product and it's already ground up. And so what flax is it's full of PUFA, polyunsaturated fatty acids. So flax has a lot of PUFA, and PUFA has a tendency to be oxidized really rapidly. And so what we don't want is this pre-ground flax. So like if you buy a bag of the flax and it's already been ground up, that means that light and air have been exposed to the fats, the PUFA fats in that flax, and that stuff's already oxidized by the time you get it home and start using it. So if you're going to use flax, get you the whole organic seed. And when you're adding it to whatever you're adding it to, grind before use. but don't buy it pre-ground. And then you'll avoid the oxidized rancidity of the oils themselves that can then create problems. This is one of the problems with seed oils as a whole. When you go to the store and you buy, all the different oils that people cook with that I don't really recommend, like canola oil, corn oil, etc. Those oils are from seeds, and those oils are highly oxidized by the time you get them into your pot. So this is one of the reasons they cause so much damage, because you're basically eating rotten food that's been deodorized. What about teff? All right, read No Grain, No Pain. Teff is another one. It's not gluten-free. It's an ancient grain, but it is not a gluten-free grain. Persists in the skin. Is it okay with iodine from kelp? How much iodine should there be per day? I generally start, if I'm trying to get therapeutic amounts of iodine into somebody, I generally start at 12.5 milligrams a day. So I don't know if that helps you, but as far as kelp, I mean, you can eat a lot of kelp, but it just depends on the concentration of the kelp, where your kelp is from, how much iodine is in the kelp that you're eating. Could iron supplement cause loose, dark stools? Not so much loose stools, but iron typically constipates, so I wouldn't blame it on the looser stool. But could iron increase the dark discoloration of the stool? It can. Now, that being said, it may not be. The other thing that causes dark stools is blood. So you want to be real careful there. You might consider asking your doctor to run a type of test on you where they're looking at occult blood in your stool, because sometimes you can see it and sometimes you can't. If it's just a darker stool, iron is a big one. If you do any kind of charcoal products, that can turn your stool dark. Outside of that, mainly, if you're not getting exposure to any chemical dyes or things of that nature, it's blood. And the blood, what it does is it oxidizes. So it's oxidized blood, it turns dark. So it's not necessarily bright red, especially if it's blood that, damage from the stomach or upper small intestine. And so there's a test called an occult blood test that you can ask your doctor to measure and look for that. Because if you're having any kind of GI tract, but if you're healthy, maybe not so much. But if you're having a GI tract problem and you're having blood loss through your gut, you want to definitely know about it, because you want to figure out, if you do have that, you want to figure out what to do about it or what's causing it. Strep advice: lingering sensitive throat after strep. I said this earlier about a lingering sore throat, and that's zinc. A zinc lozenge would be what I would recommend. So we have a product called Zinc Soothe, and I'll do a couple of those a day and see if that doesn't take care of it for you. Where to do the INA test in Portland, Oregon? We have blood draw sites all over the U.S. So if you reach out, Marika, you can reach out to Glutenology at Gmail and talk with, Elizabeth or Maya, and they'll walk you exactly through it. So just reach out, just call us. We can put the phone number up and call us, and they can help you understand where to go to get the blood drawn. A friend is severely deficient in iron, an 18 on her test, an 18 in her iron, in her serum iron, I'm assuming is what you mean. She had a biopsy and endoscopy, which didn't show anything. What would you suggest she do? Okay. It's kind of a complex question, because it's not always just that simple. So biopsy and endoscopy. False negatives. Super common if we're talking about villus atrophy or damage. In endoscopy biopsy, usually what they do, and think about it like this: your small intestine which is what an endoscopy is looking at. It's 22 feet long. And if you unfold all the folds, there's a lot of rugae and villi, and if you unfold the surface area of your small intestine is the size of a tennis court. It's pretty big. If you ever been on a tennis court, walked around a tennis court, you know it's pretty good size. So imagine all of that tennis court just folded up microscopically, and it fit, and they fold it into a tube, and it's inside you, and it's your small intestine. So when a doctor's doing an endoscopy and they're looking at a biopsy, usually what they're doing is they're taking about 4 samples. So imagine if you walked out on a tennis court with a pair of tweezers and you took 4 microscopic samples of areas of the tennis court, and then you came back and you looked at your samples and said, you know what, that's a great tennis court. The green paint's where the green paint's supposed to be, the white paint is where the white paint is supposed to be. But the samples that you took, look at a tennis court, here's the net, you know, here's your lines. So if I took my sample here, 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 and here, and I found nothing wrong, but over here somebody took a sledgehammer and beat the hell out of the surface and it was all crumbled up, but I didn't take a biopsy from that area. Or maybe, you know, the weather and the erosion was getting in through where the net pole goes in, and so it was decaying, you know, part of that area through here. And I didn't measure, I didn't get a sample from that area. I think you guys understand the point. It's that this type of test is not definitive. If they find a problem, there's a problem. But if they don't find a problem, it doesn't mean there's not a problem. I actually had a patient one time, had 19 biopsies. The 20th, 19 were negative, the 20th was positive, and this took several decades of her life to finally get a diagnosis of celiac disease. And so this is where a lot of times it depends on your doctor. So if your doctor wants to be more thorough than just doing a scope, they could do what's called serology, and maybe they did. The serology would be measuring antibodies to something called TTG, tissue transglutaminase is what that stands for. It's an antibody that we see in people that are reacting to gluten. There's another kind of antibody called anti-endomysial antibodies, and that can be measured. And then there's something called anti-gliadin. Gliadin is the name of the gluten found in wheat, so that can sometimes be helpful. But these serology or blood tests, sometimes we'll find evidence of gluten reactivity from these. Now, my favorite way, if you've just got somebody that we suspect is gluten sensitive and their iron's low, and by the way, iron deficiency is the #1 nutritional deficiency in people with gluten sensitivity. I see people all the time that have had iron deficiency their whole life. Nobody figured it out. We do a simple what? We do a simple DNA test. That's it. We test for something called HLA DQ genes. And so there are specific alleles that we're looking for on the HLA DQ. There's an alpha 1 and a beta 1 DQ, HLA DQ gene. So there's 2 genes, an alpha 1 and a beta 1. There's 4 total alleles. And we're looking for positive alleles for gluten sensitivity and positive alleles for celiac disease. And some people have what are called non-celiac alleles. Because some doctors do genetic testing. They will do this. If they suspect celiac disease, they'll do an HLA DQ test, and they'll only be looking for what's called 2s and 8s. 2s and 8s are specific alleles linked to celiac disease, but 1s and 3s are alleles linked to non-celiac gluten sensitivity, and you got to measure all of them. You can't just stop at the 2 and the 8, and most doctors do. They stop at the 2 and the 8. I know this is probably way over many of your heads if you don't understand this stuff, but what I'm trying to get to is the best way, if you really want to rule gluten sensitivity out and these tests are showing up negative, but you still suspect gluten as a potential, is to measure HLA-DQ. You can do that through your doctor, but if they don't know about 1s and 3s, you're not going to get those results. And if you have 1s and 3s and not 2s and 8s, you could also get a false negative result. So my advice, if you really want to get accuracy, go to Gluten-Free Society. We actually do HLA-DQ testing there for that reason, because so many people struggle to even figure out whether or not they need to go gluten-free. So we'll put a link up for you for that type of test. So that's one of the biggest causes. Gluten is one of the biggest causes of iron deficiency. Now, I know that's just part of the answer to the question. The other component here is blood loss. And there are a lot of things that can cause. I just mentioned that you could have blood loss in the intestine. You know, there's different types of bacterial infections. For example, H. pylori is a bacteria that can damage the stomach and cause stomach bleeding, which leads to occult blood loss. In that occult blood loss, we lose iron. The iron's coming out through the stool. It's coming out through the poop. And you don't see it because occult blood is more brown or dark. It's not bloody. It's not like blood in the toilet bowl. So this is just one of many possibilities. Anything that can damage the GI tract itself. So inflammatory bowel diseases, beyond celiac disease would be like Crohn's or ulcerative colitis, or any of the other itis, intestinal conditions. But then you also have women who have menstrual cycles. So menstruation is a risk factor for iron loss. And I see a lot of times where you get women that have heavier cycles, they get what I call transient anemia. So it's an anemia that it's kind of ebbing and flowing as their cycle ebbs and flows. As they lose blood, they go anemic, and then their body rebuilds it. And then they're not anemic for a week and a half or so, and then they have another cycle and they're anemic again. And so they're like, why am I so tired around my cycle? Why do I feel so lethargic and short of breath and cranky and irritable? It's because you're dipping in that iron deficiency anemia stage repetitively. I know I probably gave you more of an answer than what you were asking for, but I felt like the context was necessary for you. So I hope that was helpful. Let's see here. Can you address post-viral depression? I'm hearing that it's common with influenza strain going around. Yeah, probably the most common cause of post-viral depression, aside from just the inflammation. So what happens, when you get a cytokine damage, you can get inflammation, what we call brain inflammation. Inflammation in your brain. And this can affect neurochemicals, and that outcome can lead to depression. That's a possibility. One of the other possibilities is after an infection, your protein is low. You need to bolster your protein after an infection. A lot of people already, as I mentioned earlier, don't eat enough protein. They're 60, 70 grams a day, but they're maybe 120 or more pounds, and that's half of what their body actually needs. But when you're coming out of an infection, if you understand what protein does, you go back and watch my show on Tuesday. I talked a long time about protein on purpose. It's one of the most important nutrients as it relates to your immune system's ability to recover post-infection. And this is one of the reasons why we'll see depression. This is another one of the reasons why we'll see hair loss about a month to 2 months after infection. Women especially are more susceptible because men have more protein mass. As a general rule, men also eat more protein than women do. But we'll see a type of hair loss called telogen effluvium because their body was taking every ounce of protein it could to help fight the infection. And that's what we use. Protein's an immune tool. Our immune system, it's not just our muscles, but our immune system uses protein to make a number of the different chemicals, the peptides that fight viruses and bacteria. The immune system also uses protein to make antibodies. So check your protein status first thing. And if you find that you are eating low amounts of protein, definitely you want to look at incorporating more. I do a gram of protein per pound of lean body mass weight. Any information on optical migraines? Oh man, top two. We'll give you top two. See these all the time. Actually, I used to get them myself personally. Optical migraines is when you see visual disturbances. You see like kind of these little fuzzy, hazy electrical circuits in your eye field. One of the biggest things that causes it is mycotoxins. So if you've never had ocular migraines before and you're all of a sudden experiencing ocular or optical migraines, consider strongly that you're being exposed to mold. Mold absorbs, boom, right in, and it can affect the optic nerve in a big way, and it can create those visual disturbances. One of the other things that we see very commonly is gluten. And the reason why is gluten is a neurotoxin that damages the optic nerve as well. So both mycotoxins and gluten can both be neurotoxins that drive this process. Other things that can drive it, vitamin B2, vitamin B12, magnesium, CoQ10. All these deficiencies are some of the most common nutrient deficits that we see in people with migraine, optical as well as other types of migraines. And some of the reasons why has to do with these nutrients play a major role in the production of something called myelin. Myelin is the coating that wraps around your nerves and insulates them and allows them to properly distribute their message. And when you start having demyelinization in those areas, that manifests as migraine, as optical migraine. I love wild sockeye salmon. Can I eat it every day or should I stick to it 3 times a week as recommended? It depends on who you're buying it from. Do they do mercury testing? Because that's your biggest risk, is that there's potential for mercury in the product, and that if you eat it every day, that you could get too much mercury. So Monica, I would say call the people that you're buying it from and ask them if they do any testing of their product. If they don't, you maybe stick to it 3 times a week, or consider getting what's called a pre and post provocation test done, after about 3 months of daily consumption to see if your mercury levels are going up. How do you treat chronic kidney disease stage 2? So I don't, it's a philosophy question more than anything else, because I don't treat chronic kidney disease. I'm not a big fan of the myth of the diagnosis treatment model of healthcare. Diagnosis, in this case, chronic kidney disease stage 2. Okay, diagnosis just triggers, in medicine, just triggers a flow chart for probably a nephrologist or another doctor treating kidney disease to start consider medications to do what? To take pressure off the kidneys, and also diet change, although the diet change for chronic kidney problems is usually a low protein diet, which means what? Which means you're going to wreck your health, and you're probably going to be on a high carb diet. And the problem with that is high carb diets contribute to increased blood sugar, and increased blood sugar is the number one reason we see chronic kidney disease develop. So a low protein diet is actually your enemy, even though that's what the nephrologist will tell you the opposite. So what I'm getting at is the diagnosis prompts a treatment. I don't believe in that model. This is just what they're calling it. You have kidneys that aren't working optimally. It's not about what to call it, and it's not about what to treat it with, when medicine is really predominantly the option that's being used. It's really more along lines of what causes it. Why are your kidneys not working as well? What's driving it? What are some of the biggest factors that drive chronic kidney disease? Number 1, high carb diets. Number 2, food reactions. Number 3, microbial damage. So bacteria, yeast, other kinds of microbial issues. And number 4, nutritional deficit. Classic example, chronic kidney disease, vitamin D deficiency, very, very common. So to me, I'm asking these questions. What has led to this diagnosis in that person? Is it their diet? Is it what they're eating? Is it microbes? Is it what they're lacking? Do they have chemical exposures that are damaging their kidneys that need to be investigated? Because treatment is a myth. When you say treatment, it's just my opinion, folks. It's my philosophy. Treatment is, okay, what drug are we going to use to chemically manipulate the expression of symptoms in your body so that you feel better about your condition, but we're not actually solving your condition. Therefore, we're giving you a false sense of security. And in that false sense of security, you keep doing the things that are wrong and you advance your disease further until the medicines quit working. And then we say, oh, we gave it our best. We tried. That's not a plan. To me, that's guaranteed failure. It just takes longer to get there when you manipulate people's symptoms. So we want to know what's driving the chronic kidney disease. And as a functional core, simple way to describe it, food, chemical exposure, microbial exposure, and nutritional deficit are the things that are going to drive it. And so you have to get with a doctor who understands that and can measure those things, and not necessarily, try to blame it on you're just broken and therefore you need these medicines that, typically we use to treat high blood pressure, but we're going to use them to preserve your kidney function. I like this comment. So Tanya says, I had stage 2 kidney disease and fixed it in less than a year when I changed my diet. Bingo, no grain, eat meat, no processed food, eat manuka honey and some veggies, lost weight, kidneys are better. Thank you for sharing. I'm sure the person with chronic kidney disease still will appreciate your comment. Can frozen shoulder be caused by elevated blood sugar? Yes, partly that can be a contributing factor for sure. I started taking NAC every 6 months. Now tons of people and grandkids been sick when I feel something coming on a double or triple dose for a few days and I haven't caught any sickness. That makes sense to me. The research in humans shows that NAC reduces the potential for getting sick. It reduces the duration of sickness should you get sick, and it reduces the symptoms as well should you get sick. I need to make children's supplements. We have some. We have a children's multivitamin, we have a children's omega, and we have a children's digestive enzyme. Those are the 3 formulas that we have designed specifically for kids. But kids can use our other supplements too. The doses just have to be appropriated properly. How to treat a pneumothorax? I mean, a pneumothorax is more of a medical situation, Josh, versus a nutritional situation. It is, depending on your pneumothorax, but there's not like going to be a vitamin or a nutrient that is going to make that go away. When should you take BCAAs? If it's before meals, how long before the meal? Ideally, depends on why you're taking them, but if you're taking BCAAs because you're deficient in them, any time is okay. If you're taking them as part of a tool to help you recover from training soreness, exercise soreness, take them after your workout. Ideally, you want to take them away from other protein, but ideally, in a perfect world, you don't have to, but in a perfect world, you take them without other proteins because you don't want the other amino acids competing for their absorption. One of my guys got the herpes bar for expansion, or the herpes bar for expansion, and it fell out within a week. Palate just moved. Yeah, I hard to comment on that, without knowledge of the patient. Filtering my water of fluoride helped me to stop clenching my jaw. Amen to that. Light burning sensation when going to the bathroom. Why? It's possible you have a urinary tract infection. Get a urinalysis done and see if there's bacteria in your urine or yeast in your urine. That's one of the common causes. High oxalate diets can also cause burning sensation on urination as well. Can resting the tongue against the roof of the tongue, you mean the roof of the mouth, maybe, help change the jaw structure? Resting the tongue against the roof of the mouth? No, I mean, that by itself is not going to change your jaw structure. My doctor wants to do trigger point injections with liquid ibuprofen. Why? There's so many other potential options. Why liquid ibuprofen? That just seems like an odd choice to me. Have you done laser therapy? Have you done ultrasonic therapy on the trigger points? Have you done myofascial release? Have you done Graston technique on those? Have you changed your diet? Because the fact of the matter is, if you haven't really done those things and figured out why your body's forming aggressive trigger points, it doesn't matter what you inject for trigger point treatment, it's going to come back. And ibuprofen, it probably is not going to have the same effect as if when you're taking it orally, at least on the mucosal lining of your GI tract. But ibuprofen does block vitamin C, it does inhibit iron, and it does inhibit folate. And those three nutrients are very important for the health and the integrity of your muscles, your tendons, and ligaments. So just to me, it just seems like an odd choice to want to inject liquid ibuprofen. How to improve one's voice, which has become rough because of continuous bronchitis and GERD. Solve for the GERD. Why do you have GERD? Why do you have chronic bronchitis? What's driving the inflammation in the first place? There's not a magic formula to solve, to improve your voice. I've had singers, professional singers and church singers and just people who love to sing come to me and not have their singing voice and be very sad about that. And when we change their diet and we get the right nutrients in them, guess what? Their GERD goes away, their bronchitis goes away, and their voice heals. So you got to figure out what you're missing in those realms. We talk about food, chemicals, microbes, nutritional deficiencies as being the primary drivers of inflammation. So what are your drivers? Gluten-Free Society offers many tests that help people discover what those drivers are. I talk about this every week. We offer food sensitivity testing, we offer gluten testing, and we offer micronutrient, vitamin and mineral deficiency testing so that you can get some of the answers to those triggers. I get it. You go to your doctor and they don't know any of this stuff, and they're like looking at you like you're crazy. That's why we offer those things at Gluten-Free Society, so that you guys can have access to something that can give you some real answers. I have DQ8 on all 4 alleles. Does that mean I got them from both parents? And is it very likely my kids will also have these positive alleles? Not likely. It's definite. So if you have all 4 DQ8 alleles, actually, let's do it this way. So if you're looking at your test result, there's an alpha 1 gene and there's an HLA DQ beta 1 gene. And every gene has 2 alleles. I'm going to call this allele 1 and allele 2. Same thing down here. So your alpha 1 gene has 2 pieces. You inherit one piece from your mom and the other piece from your dad, right? So one piece has to come from your mom, one piece has to come from your dad, and the same is true down here. So if you have, in this case, you have 8, 8, 8, and 8. All 4 alleles are positive. That means mom gave you an 8 on this gene, and dad gave you an 8 on that gene. We're certain of that. Same thing with this one. Mom gave you 1 on this gene, and dad gave you 1 on this allele. So that means mom and dad both have at least 2 positive 8s. This also means downstream from you, so if we look at your children, that all of your kids will have 2 8s. We know that because you only have 8s to give, right? You're going to give all of your children are either going to get this one from you or this one from you. Same thing with this gene. They're either going to get that one or that one. But since you only have 8s to give, all of your kids have 2 8s. All of your parents have 2 8s. And that's as far as we can take it with that information. I recently got a terrible itchy rash on my feet and hands, and the itching was intense. Thought it might be dairy, but doctor said food was would never give you a rash. Fire your doctor. No, not really. I mean, yeah, really. I would, if that were my doctor, I'd fire them. To say that food could never give you a rash. I mean, what an idiot. What did we learn in school? What's one of the primary lessons in school that we learn about is that IgE food allergies, one of the primary symptoms is rash. This isn't like weird esoteric information. This is like fundamentally something that's taught in school. IgE, now a lot of the mainstream medicine they don't like when people talk about food sensitivities, which is it's not the same thing as a rash, as an IgE allergy. So sensitivities are not allergies. They're different. And the main difference is that an allergy is mediated by a chemical called IgE, which is an antibody that we make. This is like the kid with the peanut allergy or the shellfish allergy or the dairy allergy, and they get a damn rash because their doctor told them that food had nothing to do with it. And they keep getting it because their doctor's an idiot. Then you have sensitivities, which aren't allergies, but generally sensitivities are mediated by a different set of antibodies. So you get IgG, you get IgA, and you get IgM. And this is not a mystery either. I mean, these are medical facts. But unfortunately, these are just not things doctors look at. Why? Because nutrition, including food causing immune responses, isn't taught in medical school. If you look at medical school curriculums across the globe, I think at the last major study that published on this, it was the average coursework in nutrition in a medical school was less than 7 hours. So, I mean, I get frustrated with doctors because they don't know this stuff, but it's like, it isn't, at the same time, it's not their fault because the curriculum's not teaching it. So who do you blame the curriculum on? You can't blame the graduated doctor on the curriculum that the school taught him. But you can blame the doctor for not learning more. I mean, part of our job as doctors is when we graduate, the learning didn't stop. We don't stop learning because we graduated. Like, that's the worst kind of doctor, right? Doctors gain in knowledge and experience. They go to seminars and then they learn from their patients and their experiences. So what maybe starts as less than 7 hours should evolve into 10, 20,000 hours over a career, easy. But it doesn't. Why? Because this is the mantra. This is, if the school doesn't place an importance on it, then the practicing doctor won't place an importance on it. And then what you get is an army of doctors who know nothing about nutrition. And what's even worse is the outcome of that is the worst chronic disease that we've ever seen in human history that causes us $4 trillion of financial loss a year, not to include, that's just the financial loss. It doesn't include the suffering. Because if your doctor's telling you that and you didn't show up today and you didn't learn that food can definitely cause a rash, how many more years would you let your kid have a rash while you're medicating the kid with Benadryl or, Singulair or some other type of allergy medication, which we know allergy medications cause brain damage over time. They also cause stomach digestive problems and lead to malnutrition. So you're treating a symptom, chemically that could just simply be changed by food. And again, I'm just so frustrated with it. I know you got to be, but it's just irresponsible. But answer your question, rant ended. Yes, absolutely, food can cause skin rashes. Matter of fact, I'm just curious, how many of you in the audience today have had a skin rash, whether it's dermatitis or pediformis or eczema or psoriasis or atopic dermatitis, have had that go away with diet change, especially if you've been following me for any length of time and you're going through no grain, no pain. I'd just love to see commentary of people maybe on the show here who've had a skin rash go away. Is parsley good for binding mercury? It's not. It wouldn't be my first choice, but I mean, it does have some chelative effects with mercury. What can be done to restore the gut for a vegetarian person who's undergone chemotherapy 10 years ago, but suffering from GERD, low stomach acid, and indigestion? You got to get with somebody. It's too broad of a question. I mean, chemotherapy, what that tells me is you've had cancer, and it was 10 years ago, and that you've moved on. That was 10 years ago, but you still have damage. Maybe it was caused from the chemo, but maybe you have GERD for a completely different reason. There's just too much dynamic variability within that question. I would say start with working with a functional medicine doctor that can do some objective measuring of your food, of your chemical exposures, of your microbial exposures, and of your nutritional status. How to bind arsenic and thallium, very high since the LA fires. I mean, I have a product that we use, Elizabeth, called Ultra Metal Detox, and it's got a number of different binding agents in it that can be used as a broad spectrum approach, but that's where I would probably start. I suddenly got a flu for 3 days. I don't know this flu was caused for weather or deficiency of vitamins. Me neither. I mean, without seeing you in person and doing an examination and a more detailed history, I don't know why you got a flu for 3 days. People get sick. I think it's important to understand that just because a person gets sick doesn't mean they're a failure or their immune system's failed. Sometimes environmental exposures get the best of the healthiest of people. And I think that's where it's so important to take into context that you're not trying to never be sick. What you're trying to do is put all of the odds in your favor. So when we talked about it on Tuesday, I said, how do you put the odds in your favor? You eat well, you sleep well, you get sunshine on a regular basis, you make sure nutritionally that your body's being taken care of, you manage and mitigate your stress, you don't consume things that are poisonous like ultra-processed foods and alcohol. Look, that's all risk mitigation. There are no guarantees in health and life because we don't know what we don't know. And even though I can answer a lot of your questions and I can have solutions for a lot of your problems, I don't know everything by any stretch. But what I do know is if you put the odds in your favor, you'll reduce the potential risk. And if you still get sick, even doing that, you'll be sick probably less of a time than a person who doesn't do those things. And Nola says, Dr. O, can no grain, no pain heal hiatal hernia? I've seen hiatal hernias, or I've had people come to me that had prior diagnoses of hiatal hernias. We changed their diet, we put them on no grain, no pain, and guess what? Their problem goes away. The hiatal hernias can heal. You can have a hernia that heals. You can also have them that don't. I don't want to say that it's 100%, but definitely I've seen cases where people got much better changing their diet and resolved in many cases. I had a cheat day containing a lot of gluten last year in February. I now know I'm genetically gluten sensitive. My feet have been hurting since March. Could that be related to eating gluten? Since March of 2025, they've been hurting. You may have another problem. Like if you've got pain in your feet, I don't know what kind of pain it is. If it's burning pain, if it's like neuropathic pain, or if it's achiness or sharpness, or what kind of pain, because that would give me more insight as to kind of how to guide you in a maybe a different direction. But it shouldn't take, if you had one cheat day in February of 2025, and your feet started to hurt in March, and they've been hurting since then, so almost a year, 10 months, shouldn't take that long unless you just are getting a lot of cross-contamination or other exposure, or unless there's probably something else going on. Because a 10-month-old, a 12-month-old exposure, you shouldn't still be symptomatic at this point, if all things being equal, if you're doing everything else well. Did we fix the background noise, Mel? Not hearing it? Maybe they're trying to censor me again. Can high vitamin C cause sleep interference? Split into 3 doses. My friend is experiencing the same thing. Typically, no, but stop it. Stop it for several days and see if your sleep improves. And then add it back in. And if your sleep digresses again, you have an answer. The thing about vitamins and minerals is it's not a general. With vitamins and minerals, especially water soluble, there's not like a general toxicity of any of them, but that doesn't mean you can't have a unique experience. So it's always good if you suspect a supplement might be causing a symptom to stop that supplement and then reintroduce it to help you to better determine whether or not that's true. DH for 40 years, change. Okay, we got that. My husband's went away after diet change. Oh, so these were the people answering the rash question. So DH for 40 years, food changed everything. My husband's rash went away after diet change. Yes, rashes go away with no grain and came back when I was testing foods in the early stages. Yes, gluten diet and topical chemicals caused my rash. Yes, eczema improved with fasting. So, there you have it. I don't remember who asked that question, but real time in the feed, people saying yes, food changed their rashes. So hopefully that gives you the courage either to have a deeper conversation with your doctor or to fire them and get a one that will acknowledge your concerns around food. I have ulcerative colitis. Mayo Clinic 3 patient, and doctors gave me corticosteroids and a biologic. I feel better. Does any other treatment that completely cure ulcerative colitis? Ulcerative colitis for most people is one of two things, in my experience. It's bacterial infection of the intestine, bacterial imbalance. So commonly with UC, you get bacteria like C. diff. I don't know if they tested you for C. diff, but you can get other bacteria, Klebsiella, Pseudomonas. These are just examples of microbes that can drive ulcerative colitis. And then food, very simply put, food, big time. See it all the time, food. What do we see with ulcerative colitis? Predominantly grain, dairy, and sugar. The drugs, all they're doing is silencing your immune system. Remember what ulcerative colitis is. It's an autoimmune disease that damages the large intestine, in this case, the left side of the large intestine typically. And when you take biologics and when you take steroids, you're not fixing the problem or curing the problem. You're treating and managing the symptoms of the problem, but at a cost. What is the cost? Immunosuppression. You're trading the symptoms to suppress your immune system. So now what are you? You're more susceptible to other infections. You're more susceptible to other problems. You're more susceptible to cancers. So how do play that out over the next 10 or 15 or 20 years? Nobody can predict the future. I'm not saying this to scare you or try to guarantee your future is bad because of those medicines, but it's just my experience that when people do those things over long periods of time, the outcomes usually aren't good and working in their favor because they're not solving for why the disease exists. Again, going back to what I said earlier, the diagnosis, it's a trap. I mean, you have X disease, therefore you need these drugs. Therefore, take these drugs the rest of your life and come back to me every 6 months for more procedures and more treatment. It's very profitable, but where does it land you? It doesn't give you a cure. It gives you symptomatic management, and what does that cost you? Aside from financial dollars, it costs you the side effect, prolonged long-term side effects of the medications, which in your case, we're talking about immunosuppression. More people chiming in about rashes. Rashes, dry skin, eczema spots all went away. Also acne, rashes on the neck for lifetime went away. Wishing 2 weeks, no wheat. Yes, gluten diet and topical chemicals cause skin rash. Yes, eczema improved with fasting. Hadn't really been paying attention, but winter eczema hasn't popped its head since I changed my diet and was not even 100% grain-free, far less for sure. So improved even without being perfect. Ganglion cyst on my wrist. Is it caused by any nutritional deficiencies? I would look for B vitamins to be a primary trigger in ganglion cysts. So I would look to get my B vitamin levels checked or tested. Started getting a skin rash around puberty and no doctor could figure it out. The sun seemed to trigger an itchy rash. As I've aged, I hardly get it anymore, maybe because I eat better. It's very possible. Hard to say for sure, but I wouldn't put it past diet change. How to increase lean muscle? Exercise, eat protein. That's the simplest 2-point answer I could give you. A sudden increase. What causes a sudden increase in acid reflux? Yes, it can be related, Ruby, to food reactions for sure. And food reactions can be acquired, meaning you could be fine with the food for a long time and then you get a cold or a flu and it causes leaky gut and you start reacting to some foods, and that can lead to that type of problem for sure. Go down a little bit more here. I love this. Lois says, my friend flew home to Europe with your genetic test kit from the US at Christmas. I took the test. She flew back with it. I have 3 of the 4 gene alleles, so it makes sense that no grain, no pain is helping me. 1 year. Thanks. You're welcome. I've said it before. I'll say it again. I was diagnosed with fibromyalgia and started watching Dr. Osborne and believing no grain, no pain. I no longer have fibromyalgia, no pain, because no grain. Love it. The flu COVID symptom mix is miserable. Please, any ideas? You've got to look at your environment. If you're getting frequent colds and flus, like a COVID/flu with a lot of pain, and you're having it recurring, if it's recurring in a repetitive fashion, you've got an immune problem. You need to get your micronutrient levels measured if you haven't already, to help to discern if there's anything that your immune system is lacking to be able to help you overcome better. I would also look at protein, as I mentioned before, as a primary. Count your protein for 3 days. Use one of these free food counting apps and just get 3 days worth of counting. And if your protein is under the mark, remember it should be 1 gram of protein per lean body weight. Meaning that if you're 40 pounds overweight, you don't take your weight there. You take your weight as it would be if you were lean, and that's how many grams per day of protein that you need. And if you're not getting that, it makes sense that you're getting this combination of terrible symptoms. That's where I would start. It's the low-hanging fruit, so to speak. For folks with Addison's disease, if the hydrocortisone is bad, is there an alternative? Yeah, find out what's driving the Addisons. I've had people with Addisons get off their medicines despite doctors telling them they'll never be able to do so. So, it goes back to Addison's is an autoimmune disease. What causes autoimmunity? Food, chemicals, microbes, nutritional deficiencies. Measure them, address them. As you address them, one of two outcomes is going to happen. You're either going to get better, or actually three outcomes. You're going to get better, you're going to get better and plateau, or you're not going to, no change. If you get better, now you can work with that doctor that's got you on those steroids, and you can start trying to do a wean under medical monitoring. It's always important when you're trying to get off of medicine, especially in this case with Addison's, that you don't just try to quit something cold turkey. You got to do all the work first, change your diet and your lifestyle, put the work in, then go back and see how your Addison's is responding or reacting to those changes. 3 weeks, no grain, and my stomach is shrinking. Yes, I've lost 30 pounds in 6 months with no grain, not even exercising. Is there a vitamin deficiency that keeps causing random sore spots along the tip or edge of my tongue? B vitamins can do that. Zinc can also do that. I'll sneak in a piece of pizza once in a while and regret it every time. Well, ultimately what I've seen happen is people will do that for several years, and then they'll finally have that one opportunity where it really hammers them so bad that it becomes no longer worth it. I hope you get there. Connie says, I'm in a physical and mental mess right now. I've been going through testing for MS, but now appears to be MOGAD, but can't get back to the doctor for 2 weeks, and I feel worse. I'm grain-free. ER? You mean emergency room? I mean, you could go. I mean, if you're in a bad way, go get help. But I mean, if they're trying to do a nuanced diagnosis between two different types of autoimmunity, how well the ER is going to be able to discern that is, in question too. But I mean, if you feel like you need to get help, go get help. Don't wait to get help. But you need to get tested. I mean, Connie, I can encourage you to reach out to my office. You don't solve diseases like MOGAD or MS in a few days. There's not a solution. This is one of those things that takes months, but you got to have the right detailed information. And, like for example, autoimmune nerve disease, very commonly there's B12 deficiency that has led to demyelinization of your nerves. And that takes time to rebuild that myelin. And you've got to identify the B12 problem. Then you have to make sure you're taking and getting enough B12 in, and you're making sure you're absorbing that B12, and that your gut's not, so inflamed that it's not absorbing it properly. Like there's a process to that, and you need to get that process going, because there's not, these are not acute conditions. These are chronic conditions, but they do have acute flares, and those acute flares are what really create the bulk of problems. But you have to have a long-term solution to get it figured out. I'll put our info up for Connie. Since starting No Grain, No Pain, my energy has greatly improved and I'm sleeping much better. Thank you, Dr. Osborne. You're welcome, Ange. How to improve psoriasis? Same way. Food, chemicals, microbes, nutritional deficiencies. No grain. Start with No Grain, No Pain. Love hearing that. So I went on your gluten supplement. It started last September. By December, I lost 35 pounds. Dermatitis, aches, pain, spasms, pins, needles all went away. I can sleep through the night and without nose spray now too. Love it. Should we take calcium, or is vitamin D3 and K sufficient? Depends, Deborah. Really, if you're deficient in calcium, you should take calcium. If you're not, there's not a need to take more. And the same thing is also true of vitamin D and vitamin K. This just goes back to testing and not guessing. Ultimately, I think we could call the theme almost of every show is test, don't guess. Like, get testing done so that you're no longer speculating about whether or not something may or may not be beneficial for you. But taking a test shaves so much time and grief and struggle off of your plate, I get this so much. People come to me, they've been trying it for 10 years or 15 years, bouncing around from one thing to the next, from one idea to the next, trying this thing, trying that diet, trying this supplement for 10 years, 15 years. Quit spending all that time, energy, effort, and resource with speculation. That's probably the best advice I could give any of you. It's get measured. Whether you do it through me in my clinic or you do it through someone else that you trust, but find a good functional practitioner. I'll put mine down below for any of those of you who want to learn more about what we do. You certainly can, and I would encourage you, especially if you've been struggling a long time. Mary said, you advised me to visit a good chiropractor. I got better in just a week. Love it. Love it. Good chiropractor. You got aches and pains, you know, and even beyond that, I mean, good chiropractors. I mean, I'm a chiropractor by trade, and, you know, I just have an advanced degree and advanced certifications in nutrition beyond what the typical chiropractor has. But chiropractors are rock stars, in my opinion, as far as their ability to diagnose and help people in the natural realm. People have no idea. It's sad that only 1% of the population is served by chiropractic. And that's largely because of the misconception that chiropractors are frauds or quacks or not real doctors. I've heard it all. It's all BS. If you compare chiropractic curriculum to medical school curriculum, pound for pound, it's actually better in many ways. You take more physiology, more pathology, more biochemistry, more nutrition. You get less pharmacology. The only other big difference is that in medical school, you generally, medical school graduates go on and do a residency. They go on and do an internship and a residency. So they get trained in a practice under another expert doctor. But chiropractors do the same thing. They just don't have formal residencies or internships. They just usually go work for another doctor with 20 or 30 years of experience. So you know, the people that are out there bad mouthing, you know, the profession are just, it's sad because they don't even know what they're missing. And they're parroting whatever they've heard. It's a really interesting history. I think it was Jessica asking about the history of Rockefeller, but this is just a tidbit. But you know, it was many, many years ago, before there were state boards and regulatory boards for doctors. There were 4 major types of doctors: there were medical doctors, osteopaths, naturopaths, and chiropractors. And Rockefeller hired a guy to write a report. It's called the Flexner Report, and it was on the status of schools teaching health in the United States. And it was a scathing report. And basically what it came back and said is, we really, as a government, we really need to capture the authority over these schools and regulate everything. And just like with anything else, when government gets involved and starts regulating it, you know it's a money grab. You know they're just after the power, which is what happened. And so medical doctors came to the naturopaths and the osteopaths and the chiropractors and said, look, we're going in. The government's going into business with us, and we're going to own everything. You can join us, or we're going to put you out of business. Naturopaths told them to go to hell. Chiropractors told them to fuck off, excuse my language, and osteopaths joined them. And that's why if you go to a medical doctor, they have carte blanche diagnostics. If you go to an osteopathic, they have carte blanche diagnostics. But depending on the state that you're in, naturopaths, like in the state of Texas, naturopaths can't even call themselves doctors, even though they're doctors. They went to doctorate level training. Very smart folks. You know, there's different scopes of practice for chiropractors and naturopaths, again, depending on the state and the regulatory agencies. And this is all based on that history that had nothing to do with the quality of the education or the quality of care that these different types of doctors were offering. Because there's no such thing as one size fits all. If we've learned anything, I mean, some people do really well with medical care, and the philosophy matches them. I've had patients that, you know, when they came to see me and I said, look, this is my philosophy and this is the way I do things, it was a deterrent for them. It wasn't their philosophy, and we didn't share the same ideology. And I was happy to refer them on to somebody who had their same ideology, and that was a good fit for them. It was a bad fit for me, so everybody wins, and vice versa. A lot of people go into the medical system that are extremely frustrated because you get a 5-minute visit with a doctor who, you know, maybe gives you a little bit of time, but not really. It's kind of a lick and a promise anymore. It's become like a McDonald's-like efficiency process in most offices. And now they're hiring, you know, nurse practitioners. No offense, the nurse practitioners are very smart people too. They're hiring, you know, physician assistants, No offense to PAs, very smart people, but the doctors are so busy themselves, they're hiring subspecialty non-doctors to see all the patients. And so now people going in, they're seeing a PA, they're seeing an NP, they're getting a diagnosis. Maybe the care isn't quite as good. Maybe in some cases it's better, depending. But at the end of the day, they're so swamped and they're so busy that you can't get enough time to get anything accomplished. You can't even get enough time in the office to get to have a real conversation of meaning where there's context around why a person might be developing illness. So just, it's sad. It's really, really sad that people don't understand that. Anyway, I'm ranting again. Okay, I think we're about out of time. Let's see if I missed any just kind of last second questions. BJ says, is your testing available in Canada? Yes, BJ, we do international consultations where we can do testing internationally. So reach out. Happy to talk with you. Thoughts on acupuncture? I love it. I think it's a great profession. My wife is trained in acupuncture. She doesn't practice it anymore. She's been kind of semi-retired for close to 20 years now. But I love acupuncture, and I think you have a good acupuncturist. There's a lot acupuncture can do too. There's a lot of alternative treatments. The term alternative is just BS. I mean, alternative just means that it's not, the medical doctor doesn't prescribe it or do it. But alternative, the kind of the name insinuates that, oh, it's this alternate thing that you might try if the real stuff fails. Like, that's the insinuation. My reality, when they say alternative, I think that should be called primary care. Acupuncture should be in primary care. Chiropractic should be primary care. Nutrition should be primary care. Exercise should be primary care. Taking medicines with horrific side effects should be alternative care when the natural things fail, in which case medicine may be a great option. But natural things work so much more effectively in the long term, and they're so much less expensive. Okay, that's it. I think I got them all. You guys have a fantastic weekend. We'll be back next Tuesday for another live, or rather, not live, crash course. We'll be back next Thursday for another live Q&A. Again, if you're new to the show, come visit me at Gluten-Free Society. If you sign up for our newsletter there, we'll send you a bunch of fantastic free information about how to navigate health and change your diet, change your life, and improve your life. Remember, our mission here is to save 100 million lives. That's what we're about. We want to help people. So come take advantage of the knowledge. Also, if you're wanting the show notes from Tuesday, if you ever want the show notes, check the link below. A lot of you are reporting about glares on the screen, and I just want to make that commentary real quick because we put and provide all the slides for you so that you can follow along at home without that screen glare. It's hard to control the glare with lighting. So at any rate, have a great weekend, and we will see you next Tuesday. Take care.